next conversation is a point of topic that everybody has been speaking about for decades, talking about HIV, specifically the survey on HIV knowledge and attitudes in the workplace. And with us in studio this morning is Yolanda Simon, Assistant Manager of the HIV Workplace Advocacy Unit at the Ministry of Labour. Good morning, Ms. Simon, and welcome.
Good morning. Thank you for having me.
It's a pleasure to have you with us on the show this morning. How are you doing today?
Pretty good, pretty good.
Excellent. So before we get into the really, I guess, the depth of this conversation, let's just get out of the way. Why now is this survey taking place?
Well, actually, this survey has been long in coming. We were trying to do this quite a number of years ago, but now is absolutely a good time because a lot of other things are happening as well. And to give you some context, we're currently finalizing the National Strategic Plan, the next 5-year plan for Trinidad and Tobago, as well as the national policy for Trinidad and Tobago, national policy on HIV and AIDS, Trinidad and Tobago. Also recently, the Ministry of Labour, the legal unit, conducted 2 national consultations towards governing this document here, the National Workplace Policy, to bring legislation to govern the policy, to strengthen it. So a lot of things are happening, and this survey is happening at the absolute defining moment where we in Trinidad and Tobago has joined the clarion call at the global level to end HIV/AIDS as a public health threat by 2030. So again, yes, you said that we've known about HIV for the longest while, but you know, with the advent of access to medication and all of that, there's been a sort of malaise. You know, people think that the epidemic is over, but it's not over. People are still being diagnosed, and we need to keep this in the public sphere.
Definitely, we do. And it's interesting as you mentioned that, because yes, I mean, in previous decades, you would have seen so much when it comes to like infomercials, raising awareness when it came to HIV. And then we got to a very sort of calm place, to say the least, which leads me to my next question, which is a stigma, because let's say the 80s and the 90s, there definitely was a stigma attached to that. Would you say that today, from your experience, you see that stigma continuing in society?
Well, stigma still exists. And again, if we put stigma in context, stigma did not start with HIV. What HIV did is allow it to come to the forefront. But stigma starts from you and I, you going to Bishop's, I going to St. James Sec, you driving a Ford Cortina, I'm driving a BMW. You know, stigma, it's effortlessly, we do it. But what HIV has done is, you know, it has really impinged on people's human rights. And so it's very delicate. And in fact, now that we have access to medication, thanks to the government of Trinidad and Tobago, for those who are HIV positive, you know, get access to free antiretrovirals. So we have access to medication, which is lovely. But what we need now is a social vaccine. That's what we need. We need people to understand that apart from a person's status, we are people too. I mean, look around, even in studio here. You don't know anybody have HIV by looking at us because we are all good-looking people. You know, but some of us can have the virus. But with medication, people are living long and prosperous lives and doing well and contributing to society. And this they must be allowed to do. And the stigma is causing, it's retarding that process. And hence in the workplace, which is what our mandate, is to ensure that the workplace is literally stigma-free. Our mandate really is to reduce stigma and discrimination, and also to reduce behaviors that put workers at risks of HIV.
Excellent. Now, let's go to the survey, because this survey, if I'm not mistaken, it's running until July 2024, correct? What are the expected outcomes of this survey, and how are we going to be able to achieve it, essentially?
Okay, so first of all, this survey, the current survey period, because the project actually started in July of last year, and it's going to conclude in September of this year. The survey period, however, it's April to July, so we're still in the survey period. The survey, it is going to be conducted amongst 500 employers and 1,000 employees. It's an online survey. It will take probably about 15 minutes to complete, and we are asking persons, when you get the survey, please take the time to fill it in, all of it, because this is your contribution. People, just as you've asked, what's happening with HIV? For those of us who've been working in the trenches for many, many years, a lot has happened, a lot of good things. But HIV is not only about the Ministry of Labor, the Ministry of Health, etc., but it's about all of us contributing to ensure that come 2030 or before that, Trinidad and Tobago can be proud to say HIV is no longer an issue.
I think it's something that we will be proud to say, that is for sure. Ms. Simon, why do you think there was that slumber period where it sort of just wasn't as prevalent when it came to raising awareness for HIV?
I think in the early days of HIV, and if I can do a comparison to the early days of COVID, we were scared.
Yeah.
We were scared. There was a lot of ignorance. There was some arrogance. But essentially, we were scared and we didn't know a lot. Happily, with the advent of science and technology, we know a lot more now. Obviously, we didn't have access to medication, so the mortality rate was extremely high. And so we were engaged, people were engaged. But now that we've had medication since 2005. The government, as I said, has been providing medication. And people have reclaimed their lives and just going on and living their lives. So it's not an issue per se. So we have made a lot of progress, but we need to build on those gains and not sit on our laurels, because that, in fact, is going to cause a reverse in all the gains we've made. So for that, and I want to come back to your question before, what are we looking for with this survey? Well, a couple of things. The objectives of the survey, we're looking at trying to, what are the myths and misconceptions and attitudes about HIV in the workplace? We want to also be able to gauge how it is that workers, in fact, how they feel about HIV and AIDS, if, in fact, there is HIV and AIDS still in the workplace, because I am almost certain in every sphere there are HIV positive people. But again, because of the stigma and discrimination, people will not voluntarily say, I have HIV, because for some of us or some people, they are summarily dismissed, or they, there's in the workplace, they're ostracized. So for some of those reasons, we're doing this survey, but essentially, what we hope to achieve by the survey is to be able to improve on the policies and strategies in support of the programs that we do for the workplace, HIV in the workplace.
And this is really good to hear, essentially knowing that, all right, we have an entire team behind this, looking at it from a policy standpoint, but also from a community standpoint. Now, aside from taking part in the survey, what can we do as citizens to break that stigma and continue to make that push for 2030?
Oh, that's an excellent question. There is so much that all of us can do. And I recently, I'm going to tell you this, I'm going to tell you a little story, short one. Recently, I had a friend going in a maxi taxi, for those of us who go in the public transportation. And again, she said, well, when last did you see Raucus? She said, well, I saw him last week in a jam session at the Black Box, but he wasn't looking so good. And the other person said, you think maybe? And this is people look at you and they make a determination. And the other person says, hello, why are you all doing that? Nothing is wrong with Raucus. He's been working out in the gym, and even if you can't tell by looking, and say it, you are insinuating that Raucus may have HIV. She said, no, you can't do that, because you're saying that somebody hearing Raucus have HIV, and the domino effect is going to happen.
Right.
So the other person arrested her immediately, and that's what we need to do. We need to arrest those conversations. We need to not add to those things. We need to tell people that's not the way to go. You can't tell by looking if someone has HIV. So
That's one of the first steps and something that is so important. Again, I mean, you're echoing something from years past, now back with us. Ms. Simon, thank you so much for joining us this morning.
Thanks.
It's been a pleasure and all the best to you and your team.
Thank you very much.
Ms. Yolanda Simon, Assistant Manager of the HIV Workplace Advocacy Unit at the Ministry of Labour, with us this morning, speaking about the survey and so much more. Stay tuned, because after this short break, we are going to be back with more. But before we get to that break, let's take a look at World Environment Day.